actually somebody asked something similar, a question that have there been any research conducted on the impact of lifestyle and diet intervention following an initial diagnosis with MS versus taking medication?
So we have studies that have looked at diet and how diet influences fatigue, quality of life. So I can talk about that in a moment. Because the current standard of care is to put people newly diagnosed on a disease-modifying treatment, some type of pharmaceutical, tablets, injections, infusions. You would not be able to get a committee that oversees research called the Institutional Review Board to agree to a randomized study that says group 1 gets lifestyle, group 2 gets drugs. That would be considered unethical. We did do a study using a quasi-experimental method, which means people could choose. I want to do diet and lifestyle, no drugs. I want to do standard of care, take the drugs, and then I'll do whatever I want with diet and lifestyle. That's called quasi-experimental. We had funding. We were going to do assessments, including MRIs at baseline. And then people who are doing drugs, we're going to do the drugs. People who are doing diet and lifestyle, we're just going to do diet and lifestyle. We're going to train them on the modified Paleolithic elimination diet, a mantra-based meditation, and a walking program. And we were start getting ready to enroll people March 2020.
I would love to join that one.
Well, I want everyone to know that when we started enrolling people March 2020, the pandemic happened. And so we could not bring people in for a in-person visit. So we had to do things virtually. So we had the people who were in the control arm, they did their DMTs, standard of care. The intervention arm got to be interviewed by me. We went over their root causes, why I thought diet and lifestyle might be super helpful. My dietitians trained them on the modified paleo diet. We trained them on a 4-7-8 breathing practice and a walking program. And unfortunately, I mean, it's super sad that we could not get people in to get all those MRIs. That would have been so helpful. But you know, that was the study that we had to do. We had 29 people in the intervention arm. 25 of the 29 completed all 12 months. Of the 25 that completed, there was a 95% self-reported excellent adherence to the modified paleo diet, a 91% adherence reported to the walking program, and I believe it was a 75% adherence to the 4-7-8 breathing meditation. They had 4 episodes of relapses, and for people who aren't getting any disease-modifying treatments, you would have anticipated about 0.7 relapses per year. So that would have predicted in the 25 people that we had that you would have had 17 relapses. So we had fewer relapses than you would have predicted. In the intervention arm, and we had 15 people in the intervention arm that completed, there was only 1 relapse. And so there's slightly fewer relapses in the intervention arm compared to the, slightly fewer relapses in the DMT arm than the modified paleo meditation and walking arm. Then the next thing that we asked, and this was the most important part of the question, is diet and lifestyle without drugs not worse on quality of life, fatigue, mental clarity than, excuse me, I'm going to have to answer this call. It's from my study team.
If you guys have any questions in the meantime, just enter it in the chat.
Okay, I have to call some more study team members because I have another a crisis I have to deal with. So forgive me. I will eventually be back.
All right. So anybody wants to share anything? We can open up the room to discussion while we are waiting for Dr. Wahls.
Adria, I'm curious to know, were you involved in the observational portion of the study or the intervention?
Can you hear me okay?
Yes.
So I was the one that did lifestyle, the paleo, the breath work, the walking study. I chose not to take a DMT after I was newly diagnosed. Well, so I after I was diagnosed, I decided I wanted to think about it, and I just wanted to look for answers instead of making one out of fear. And so a couple of weeks went by, and I had reached out to Dr. Wahls' team to work with her, like, personally. And then they mentioned, like, well, she has this study, yada yada yada. So I'm like, okay, sign me up. And so that's how I became a part of that. And I'm actually in Iowa, and I actually went to college where her research is at the University of Iowa. And so it just kind of was like one of those stars aligned. And I live, 70 miles away from Iowa, or the University of Iowa, where she is. And so, but then COVID hit, so it all became virtual, but it didn't matter. It had such an impact on my life that I never started a DMT. I reversed all my symptoms. I still maintain everything, very fairly strict. I still do the paleo diet, supplements. I probably do more exercise than I did in the intervention study. I do more breath work. I've upped my holistic care. I've included like acupuncture, sauna, chiropractic care, things like that weren't part of the study, but it's all really worked really well for me personally. My MRIs ever since have been stable. I've never had any disease progression since then. Like I said, my symptoms have been reversed, and I haven't taken a DMT ever since that, never, even when I was diagnosed. So it was a life-changing opportunity. So if you have the opportunity to get involved in one of her studies, I have nothing but great things to say about it. And if anybody has any questions about my experience, I can dive deeper if you want.
Can you share more about the food? Like what kind of food you were eating during these months?
Yeah, so it was the paleo lifestyle. So it was it'd have 3 servings of leafy greens, which was about 6 cups per day. 3 servings of very brightly colored fruits and vegetables. 3 servings of your sulfur vegetables, so like your cruciferous, onions, mushrooms, garlic, things like that all fall into that. So that was all that daily. And then quality proteins, nuts and seeds were allowed. You could do grains. I chose not to do grains, but then we did elimination options too, where we would remove food groups and then reintroduce to see how we would react. And so that was better part of a year. I think she's back, so I am back. Dr.
Hey, Adria.
Yes, I don't know if you remember me. I was telling them all about how you basically saved my life, and I have nothing but great things to say, and they all need to work with you. So.
Love you.
Love you too.
It was so wonderful meeting everyone, doing the intake. And one of the things that I learned as I went through that was how often it was that people were reporting severe early life stress, which then caused me to modify the next study that I did to include a voluntary assessment of early life stress. And it also had me thinking back to my early life stress. We grew up on a farm, lots of really wonderful things about that farm. However, my mom was pregnant, and when I was 8, she lost the baby. I was born and died the same day. And that led to, severe family stress, from which I don't think my parents ever fully recovered. And I had not ever considered the possibility until, I was interviewing Adria and all of the other folks in the lifestyle portion of the health behavior study, that I realized early life stress was a factor that I should be talking about with all of my tribe and people in my clinics. So I'll come back to that. I do want to tell you what we saw when we looked at, was the health behavior arm worse than the disease modifying drug treatment arm for changes in fatigue, changes in quality of life, mental health quality of life, physical health quality of life, mental clarity. And what we saw was, in fact, it was not inferior. So that was really super, super exciting. We were not trying to say that diet and lifestyle was better than DMTs. We just wanted to test with scientific rigor that it was not worse. Now, if I had been able to get those MRIs, we would have been able to comment, was the MRI, in terms of the number of enhancing lesions, was that not inferior to the DMTs? So we weren't able to answer that question, unfortunately. We do have another really interesting observational study that's happening, and that one is going through chart abstractions, and it was through charts that were pulled up to be abstracted from 2008 through 2018. And we're looking for a cohort of 40 patients who took DMTs, usual care, and another 40 patients who may have taken DMTs or not, but also reported when they were talking to their medical team, I'm following a diet. It doesn't really matter if it's a paleo diet, keto diet, swank diet, Mediterranean diet, vegan diet, vegetarian diet, that the patient said, I'm using diet, some sort of special diet to help manage my care. And that we've had medical students do abstractions last year. We're going to have a medical student doing abstractions this year. We'll then be able to analyze those two cohorts, and we anticipate submitting the results of that analysis, chart abstraction and analyses, and then presenting it at the Consortium of MS Centers in 2025. And again, it's an observational study. Observational studies can be super powerful, and it help us understand, where does diet and lifestyle fit into our ability to reduce the risk of relapse, reduce the risk of disease progression. I think it's going to be a long time before we'd ever be able to do a study that says we'll randomize people to take DMTs or take lifestyle. And I think it's unlikely that that kind of study will ever be approved. What may be approved, and we keep writing grants for this, we haven't gotten approved to do it yet, but ever the optimist, we'll keep writing grants, we're going to keep trying. As we get older and more mature, over the age of 45 to 55 is when you quit having relapses. You have far fewer enhancing lesions, and instead we have brain volume loss, spinal cord volume loss, and there's progressive disability. And that appears to be more age-related. So the relapses and remissions are under the age of 40. They begin to disappear and are greatly reduced, certainly by age 50. And there's a big debate, are the harms of the disease-modifying treatments, because they suppress your immune system, make you more vulnerable to infections and cancers, is it doing more harm than benefit once you hit your older years? And is that 50, 55, 60, 65? We don't really know. So there are some studies that have randomized people at varying ages, 50, 55, and 60, so that half take the DMT and half stop the DMT. I'm writing studies to say, let's give people on DMTs who are older diet and lifestyle, and after we've primed them for 3 months, so they're really on board doing the diet and lifestyle, then we'll randomize to half that stop the DMT, and half will stay on it. And we'll follow them for another 18 months and measure disability projection, are there any relapses, and brain volume loss. And if the people without DMTs, again, are not inferior to those taking DMTs, we will have finally made a case that, you know what, if you use diet and lifestyle and you're that age, whether it's 50, 55, 60, 65, somewhere in there, we can say, okay, here's a safe on-off ramp for DMTs. In my clinical practice, what I do, because people come see me like, I want to get off my DMTs because I'm having a variety of adverse effects from the DMTs. And I have to stress to them that in my practice, we don't have research that guides me how to do this safely. So wanting to not harm you, I want you to do diet and lifestyle. Ideally, also let me do a little functional medicine testing so I can really personalize my recommendations. Fix any nutritional problems that we see, address any food sensitivities that we see, address any toxins that we see. Have you come back and on your medical symptoms questionnaire, have that score show me that you're feeling better and better and better, and you're really doing great. So should I see a great response for a year, a great response for 2 years, a great response for 3 years? I don't know. And so that's a negotiation with the patient, what they would like. Most often people really want, after a year, to transition to a less potent DMT with fewer side effects. And so we might transition them to something like Copaxone or Tecfidera, which you can take by mouth. And then they perhaps transition off that entirely. And so most often it's a 2-year process, occasionally a 3-year process to get off the DMTs. And we've been able to do that for people with multiple sclerosis, psoriasis, inflammatory bowel disease, rheumatoid arthritis, systemic lupus, Hashimoto's thyroiditis. If you abruptly, you wake up, you say like, man, I just discovered Dr. Wahls, I watched her TED Talk, I ordered the book, I started the diet, and I'm stopping my drugs. That will lead to a severe relapse because we haven't changed your biochemistry long enough to calm your immune system in your brain.